afternoon, everyone, and thank you so much for joining me today for this very important topic on how to stay mentally strong while sheltering in place. Let me first thank the hardworking essential employees, the nurses, law enforcement, fire, the workers at the grocery store, and all of the people who are on the front line of this crisis. We appreciate you and we thank you so much for your service. Let me also send out sincere condolences to those who have lost someone to COVID-19. I know and I will continue to keep you lifted up in prayers and keep your family lifted up in prayers during this unimaginable time in your life. So again, I want to keep everyone lifted up in prayers who has lost someone due to COVID-19. And then, of course, rejoice for those who have survived, because I know the ordeal was something else that you've never seen before. So thank you for all of the service workers, and we're going to keep those lifted up in prayers who has lost someone and those who are recovered. We are so thankful for your recovery. And because so many of us know someone who has had COVID-19 or who has lost someone to COVID-19, this virus is not only affecting us physically, it's affecting us mentally. And that's why I thought it was important for us to come together with some of the leaders in the field in Wayne County and Detroit to speak on just how we can cope with the mental stress and anxiety that we may be feeling. Some of us have been on lockdown for weeks. Me and my children have been home together for 5 weeks. So for those of you who have children, I know it's been challenging trying to work from home as well as trying to homeschool your children. For those of you who are home alone, that poses a challenge in and of itself, especially if you're a type A personality and you're a very social being. Being at home for 4 to 5 weeks is something stressful in and of itself. So all of these stressors are coming down on us, and I thought it was very important that we have a discussion on what that looks like, to know that you're not alone, and then to give some tips on how to cope with that. According to a latest Washington Post poll, 77% of women and 61% of men are recorded of being stressed out, with 69% of women stressed that they or their family members will get this virus. So this is a very timely conversation that we're having, and we have to know that these calls to our mental health institutions across the country are spiking because of it. Our governor today, just an hour ago, spoke to the fact that they have mental health services available at the statewide level now. And if you go to the Michigan.gov website, you will see services that are now available to all of us here in Michigan on how we can cope with the stress that we are all under for various reasons. So we all understand how important this topic is. We all understand that we are in this together, but we all must know that we must continue to stay home, to stay safe, such that we can get over this hump, get back to as normal as a life as possible. But in order to do that, we have to stay home and stay safe first. So that's why I'm excited to have with us special guests to really talk about what's going on here, because they're the boots on the ground, if you will. We have special guests today, and I'm so very happy, Mr. Willie Brooks, the president and CEO of the Detroit Wayne Mental Health Authority. Under his guidance, DWMHA identifies, influences, and delivers services to nearly 80,000 Wayne County residents with serious mental illness, intellectual and developmental disabilities, and substance use disorders. Mr. Brooks serves as the chief liaison between the organization's board of directors, people receiving services, community partners, and state legislatures. He works closely with each of them to ensure that their concerns are addressed, solutions are initiated, and that Wayne County citizens in need of mental health assistance receives quality services that promote independence, inclusion, and equity. Willie's impressive professional career in mental health, physical health, and finances has been around for nearly 3 decades. So he has 3 decades of experience in this field. He is well respected among his peers for his detailed knowledge of investing, banking, and monetary policies, healthcare, interpersonal skills, and making sure that we here in Wayne County are receiving the best in mental health services. At this time, I would like to ask Mr. Willie Brooks to come on the line and share with us what you can tell us about your organization, the Detroit Wayne Mental Health Authority. Welcome, Mr. Brooks.
Thank you so much, Commissioner Bell. I also just want to thank you for putting this event together. It is well needed in our community as we can provide education and guidance during these trying times. As you mentioned, Detroit Wayne, we serve over 80,000 individuals, and there's a lot of services that we are involved in during this crisis and also outside of this crisis. The most important thing we want to acknowledge is that there is help out there. There's individuals that you can call. We're living in an unprecedented time. Typically, we serve individuals with mental illness, developmental disorders, but yet now we have expanded our new horizon to this new virus, which is really making everyone look at life completely differently. I just want to mention a few things. I have some very key people that will be talking after me, but I just want to mention a few things that's really unique to this virus. One, at Detroit Wayne, we're doing a lot working with our community and providers to assist as much as possible. You hear this term PPE, which is personal protection equipment. That is something that we're trying to equip the provider and the community with so that they can better do their jobs. Many people are putting their lives online as they battle this illness. We want to make sure that they are prepared as much as possible. I also want to mention that some of the fallout with this disease. One, as Commissioner Bell mentioned, so many people are now locked inside of their houses, basically under house arrest. And they're dealing with family members that they typically did not have to deal with on a regular basis. That is also prompting a rise in substance use and alcoholism, and is also providing a rise in domestic violence. You know, we want to take advantage of this opportunity and basically learn how to live among each other and work out some of the difficulties and reach out for help. There is help out there, regardless if you're in any type of situation, a battered situation, any type of domestic violence, there's still help available. So I just want to touch base on that. And then the last thing I want to mention, I just have to mention that this unique disease that we're dealing with has a tragic impact on minorities. And there's a lot of reasons why. There's a lot of study that is being done on that. One of the issues we know are the jobs. Many minorities are on frontline jobs that they're forced to go out of their homes to make a living and make a choice of either staying home or gathering income. So we know that those jobs on the front line is one issue that we're dealing with. Another thing that this virus is bringing up is showing the disparity in healthcare. The level of healthcare disparity throughout the state is tremendous, and things of this sort show those types of issues. The third thing that we have to be careful of is the change in culture. It is difficult for people to stay indoors, to learn how to change some of their routines. Many of our cultures like to gather, like to congregate, like to celebrate together, and we have to take advantage of some of the electronics out there as we begin to change our culture when it comes to gathering. And then the last thing, it is exposing some of the healthcare weaknesses. Many of us have pre-existing conditions, and then we also have other outlining health issues that are out there. Some, we can do something about, some we cannot do something about, but it is a constant reminder that we must make sure that we are as healthy as possible. Washing our hands and being safe is something that we should have been doing all along. but now this virus has really brought it to the forefront. So I just want to mention those things, and I would like to, at this time, just give time for some of the other guests, some of my other staff that are here, so that they can give some of their backgrounds and some of the great things that they do.
Thank you, Mr. Brooks. And you touched on many things that I hope that we'll address in more depth later on. The substance abuse of being home alone, alcoholism, domestic violence, of course, all of those rise when you're stuck at home for weeks on end. So hopefully we'll discuss that a little bit further as well, because those are serious issues and we have to provide outlets and services and resources for those people so that they won't relapse. So thank you so much, and we'll definitely come back to you. At this time, I'd like to introduce our next speaker, which is Dr. Margaret Hudson Collins, your colleague over at the Authority. Dr. Collins, thank you so much for joining us. Dr. Collins has a great resume that I will read, not all, but just in part, just so you can understand how dynamic she is. She briefly served on an interim basis in 2010 as the medical director after providing over 13 years of leadership at the Wayne County Jail in their mental health department. She was charged with upholding the department's mission on providing quality mental health services to those in the Wayne County Jail's mental health and crisis management unit. Prior to working at the Wayne County Jail, she served as Director of Psychiatry for the 3rd Judicial Circuit Court, where she provided psychiatric evaluations, recommendations for treatment plans for families being adjudicated to the system. Dr. Margaret Hudson Collins is a very well-respected doctor, and I'm so glad that she is now with the Detroit Wayne Integrated Health Network. Dr. Collins, welcome so much, and we would love to hear your insights on how this COVID-19, how being stuck in the house, how all of this manifests into physical difficulties as well. I know when we are home alone, we get anxious, we get worried, and then we have physical things that take over our bodies, such as sleep deprivation, increased heart rate, forgetfulness, difficulty focusing, all of that. So you just talk about the physical and how the mental relates to the physical, but let everyone know that it's okay and they're not alone in this. Doctor, your turn.
Thank you very much, Commissioner Bell. I appreciate this opportunity that you've given Detroit Wayne Integrated Health Network to share the information about our organization. And I have to concur with Mr. Brooks as he laid out the multifaceted issues that we all face with this virus. And when I say all, I mean all of the planet really is being affected by this virus. Not just Michigan, the whole world. But in particular in Detroit, we have certain challenges the rest of the state does not have. And Mr. Brooks kind of hit on those. They have to do with what in medicine we call comorbidities. That is people who have hypertension, diabetes, perhaps obesity, asthma, that lend them to being susceptible to the virus. So yes, it does create a sensation of anxiety, depression, there's grief, and also I think a new form of post-traumatic stress disorder that we have not seen before. And with anxiety, everybody knows something about anxiety, but in this situation, it tends to be somewhat overwhelming because of the isolation. And there's difficulty relaxing. You may have physical symptoms from the anxiety. You may overeat, undereat, have poor sleep, oversleep. And there are several symptoms that overlap with depression, the sadness, often tearfulness, being isolated alone, and sometimes isolated in a home setting that may be difficult. Also, the issues of grief. We are accustomed when we lose someone that there are rituals around which we grieve our loss, but with the COVID, we cannot grieve as we normally do with a funeral service. This exacerbates the whole issue of how we handle loss. It reminds me of the 7 steps of grief that Kubler-Ross talked about, which often include things like anger, shock, disbelief, denial, depression and bargaining with yourself, feelings of guilt. And in order to approach all of these things, one of the first things that we need to do is control the things that we can control. That is, we can get up every morning, have a regular routine, get dressed, don't stay in your pajamas, get dressed, brush your teeth, fix breakfast, dinner. You can communicate with loved ones via Skyping or telephone. People may resort to using journaling or writing diaries to track their reaction to the virus. So there are many things that we can do in this isolated situation. One thing too that is very important is we need to stop watching a lot of television. Set a time when you can watch a half hour, maybe in the morning and in the evening. But if you watch constantly the television, that will heighten your anxiety, your depression, your worry. So those are certain things that we can do, as well as prayer, meditation, breathing, yoga, being in touch with telephonically with your minister, close friends, people who are supportive of you. One of the biggest things I would avoid would be social media. A lot of social media drives a lot of the anxiety and frustration that people experience during this period of time. So focusing in on the things that we can do to make our lives a little bit more manageable and dealing with the isolation, I would invite people to get a pen and pencil, because later on we want to share some numbers for you for the suicide hotline, our Detroit Wayne Integrated Health Network hotline, as well as the domestic violence hotline. I think these are very important resources that we can use to help cope with this very overwhelming issue, emotional and psychological issues. Also, when a person becomes so overwhelmed, they cannot feel frightened or shamed into not reaching out for help. Getting the psychiatric mental health assistance. There's quite a few telemedicine, telepsychiatry types of resources out there. And I invite people to access those resources because they can be very helpful during this very difficult period.
Thank you, Doctor. Those are all great tips. And I think that's so important that we remember to have a routine, still get up. You know, a lot, the joke on Facebook is you got up and got out of your nighttime pajamas and put on your daytime pajamas, you know, but we need to actually, you know, get up, pretend like it's a day, you know, put your clothes on, brush your teeth, you know, do your hair, makeup, and just continue on your day as if it were a real day. Because if you don't, I think you'll get into that slump of just day after day like Groundhog Day, and then that could spark depression and other elements that we really want to avoid by having a routine and making your days purposeful. So those are very good tips, and I hope everyone took those tips down, as well as making sure that you communicate with someone if you do still start to feel a little down. They're your friends, your faith-based, and if you have none of that, of course, there are hotlines that we provide that you can talk to someone to get you through those difficult times. So we're going to continue that conversation, but I'd like to bring in Dana Lasipy at this time, who's also with Detroit Wayne Integrated Health. I'm going to read her bio. She also is a stellar person in this field, and I'm so glad she was able to join us today. Dana currently serves as the Chief Clinical Officer and has been a valued member of the Detroit Wayne Integrated Health Network leadership for nearly 12 years. She oversees our access and crisis system, hospital liaison, and residential care divisions that are responsible for oversight of care for nearly 75,000 individuals seen by the Detroit Wayne Integrated Health Network. Her experience includes serving as interim CEO for a year, as Director of Utilization Management, where she oversaw annual elections and reviews, compliance with federal, state, and regulatory requirements. She has more than 25 years of experience working in both the public and private sector of behavioral health, and her desire to see continued growth and improved quality of service for mental health consumers are paramount. So I'm so very glad to have Dana here as our Chief Clinical Officer for Detroit Wayne Integrated Health Network. Dana, if you could talk to us about the whole person and how we have to take care of not only our mental state, but also our physical state and how they're interrelated, and the services that you all provide at the agency. I keep saying agency. I know it's network.
Yes,
I go
yes.
to the Florida agency, but
Yes.
please die hard. but the Integrated Health Network, if you could, please.
Thank you, Commissioner Bell. Thank you again for bringing this really important topic to the light. I think it's something that we often forget about when we talk about integrated health. We forget about our mind and our spirit and our body are all connected. And at this time, they're all being challenged. So one of the things we're most proud of at Detroit Wayne Integrated Healthcare, believe me, I've had a tough time changing from the previous title as well, is this is challenging times for all of us. And it really does, if the focus has been on the medical side of what's going on with COVID-19, but we all know now, and I think it's becoming more and more out there, that this is impacting the mental health of people that we all know. And so as Dr. Collins talked about, it's really critical to get the physical health care, your mental health care, and it's really a challenge for young children to understand what's going on. And it's a challenge for people who are in recovery, who are trying to maintain their recovery at such a very, very stressful time. So a lot of the things that we've done in the last month or so is really try to shift and get into gear to serve people that we traditionally serve face-to-face. We have over 400 providers who provide residential care services, outpatient mental health services. We provide services for people, as you talked about earlier, who have intellectual developmental disability and individuals with serious mental illness. And one of the things that we also are very proud of is that we've had our providers, a lot of them shift from providing those face-to-face services to doing more of the telehealth services that Dr. Collins spoke of earlier. So our hotline number, our 24-hour crisis number is 1-800-241-4949. And I wanted to start by saying that too, because that number, hopefully everyone on this call or this webcast has seen or heard our commercials on television in the morning. We've seen our billboards, but now more than ever, there's such a need for us to let people know that we're here in the community and the services that we provide. So when we talk about COVID-19 and how we had to shift in our delivery of service, again, we had to go, a lot of our services are now provided by telehealth by our outpatient treatment providers. But we did some other things in addition to that. We have an intensive crisis stabilization unit, and what that does is provide services for people who are in crisis with a mental health condition or substance use condition that need services immediately. We really want to shift people from going to the hospital EDs, because we know now that it puts people at risk for contacting or coming in contact with individuals who are there because they're physically ill due to COVID-19. And I say that with caution though, because in saying that, we don't want people to take the risk of trying to determine, is this a physical health emergency or a mental health emergency? And there is a difference. And we don't want people, if they can't make that decision, to go and call us instead of going to the nearest ED if they feel they're having a physical health problem. So we put other things in place though, as I said, to make sure that there are services available when people are in crisis. For example, we have our COPE team, is our community outreach for psychiatric emergencies, that are available to help people in crisis. Again, they can call the 800 number to contact that service. The other piece of it is we have initiated additional intensive crisis stabilization units We have one in Livonia, Michigan, and we also have one in Detroit now, which is Team Wellness. So we have providers that are available 24/7 that can help someone in need of services in an emergency situation where they're having a psychiatric or a mental health crisis. So we want to let you know about those services where you can have a psychiatric evaluation, you can receive medication or services at that time just do a walk-in or calling our 800 number. The other things that we've done is we've looked at ways to, like I said earlier, our providers shifted. They shifted from doing a lot of face-to-face services or walk-in services. We had providers that we have identified to extend their business hours, to say we are willing to be open and available for people who have an urgent need. So we know traditionally in the medical world, if you have an urgent need, you can call your doctor and get a same-day appointment or a sick appointment. For those of us with young children, we know about that very well. This is the same thing on the mental health side. So in the event that someone feels that they have an urgent need where they need to be seen same day or within a couple of hours or so during the after hours of like extended business hours, they can go to one of our urgent behavioral health care centers. We have one in East Detroit, and we also have one in Downriver of Lincoln Behavioral Park. And so those services are available for people who need to be screened to make sure that they can receive those services, but also to come in and talk to a mental health professional to see what their need is at that time, and then to bring them in and set them up for telehealth services if those are appropriate. The other things that we've done is we've identified recovery housing or withdrawal management services. So in addition to our fully robust array of services, we have 2 providers that are now available to see individuals who have COVID-19 symptoms or have tested positive for COVID so that they can maintain their recovery. They can go to either Quality Behavioral Health or they can go to our Detroit Rescue Mission. And by adding those services specifically for people who have been exposed to or have mild to moderate COVID symptoms or even have tested positive and can be maintained and supported in that environment, we've added over 100 beds by adding these 2 providers or extending the services that they already provide. The other thing that we've done is looked at individuals who are coming out of the hospital that are traditionally receiving our services and they're not able to return to their permanent placement, or for example, they have a family who is already at risk because of exposure or some other things that are going on. We've identified pre-placement housing. So a lot of those services will accept individuals who have COVID-19 symptoms. Of course, we don't want to confuse the public by saying they can go there if they're physically ill. We still want people to go to the hospital as needed or to call ahead and have their symptoms screened. But if, in the event that there are some services there we've added because of the COVID-19, those are some that stand out, and we're constantly adding and looking for new ways to make sure that access to our behavioral health, mental health services are available. So always calling our number, checking ahead, making sure that we don't send you in the wrong direction. We want to make sure that we're screening and talking to people. And even if you just want to talk, you can call that 800 number, 241-4949, just to talk to a mental health professional about what's going on, what you're experiencing. And it's very stressful. I know that Governor Whitmore did talk about a number and a helpline that they have in place, but for individuals that live in Wayne County and in Detroit, that number is directly just for you. Other folks can call our number, but that number is specifically connects you to the Wayne County mental health services that are available here. And they can do a screening, they can get you set up with a provider. Even if you've never taken advantage of receiving mental health services before, that opportunity is extended to you. There's so many things that we can do to help and support, and we've been working with our partners in the city and in the county to make sure that we're doing everything we can to help people get through this very devastating time. And as Dr. Collins was saying, just taking care of one another. And the other thing that I have to bring about is that now we're seeing a new homeless population, because before people could go and live with their families or stay with their families when they were coming out of a mental health crisis or a psychiatric hospitalization. Now families are fearful. they're not necessarily wanting individuals to return home, even their own family members. So we're challenged, and I say it's a good challenge to have, because we're looking at ways that we can help one another, that we can extend the programs, the good programs that we already provide. So again, we have to consider all the impact that COVID-19 is having on our community, and Detroit Wayne Integrated Health Network is doing that every single day. We're looking for ways that we can help support our community as we go through this devastating time.
Thank you so much, Dana. That is great information. Everyone has provided such great information. It's good to have that 800 number that was requested a few times. We put it in the chat if you're on Zoom. If you're not on Zoom and you're on the telephone, could you repeat that number one more time, the 800 number?
It's 1-800-241-4949. And all this information is also on our website at www.dwihn.org.
Okay, very good. At this point, I would like to talk a couple of housekeeping matters. If you're on Zoom and you would like to ask a question, if you can put that question in the chat feature, and we will certainly read that question off to you. If you're on Zoom and you want to raise your hand, we will acknowledge you that you raised your hand. We will unmute you and give you the opportunity to ask a question. And if you're on the telephone, if you have a question, please email that question to me. At my email is abell3@waynecounty.com. abell3@waynecounty.com. If you email me your question, then I will read it off to you. And again, if you're on Zoom and you have something in the chat, we will read that question off to the chat. And if you raise your hand, we will allow you to ask your question yourself. So as we have those housekeeping things, and while people are trying to get that under control, Doc Collins, if you could speak to about our youth. Our young people are having a hard time with this because, of course, they would be in school. Those who are in their senior year are missing out on their prom and graduations at this time. Can you speak to how we as parents can help our young people move through this very trying time as they're going through things that they never thought that would happen to them?
Yes, I think that's a very important point. And the parents, I think, first and foremost, need to allow their young family members to express what their feelings are, validate them, and see if they can create some alternatives. There's things that I've seen on television where people have a prom, wear their prom dress at home, and have a prom function at home, or graduation function at home. It is very challenging, especially because this is a period when we're really having a crisis of suicide and drug addiction and vaping amongst our young people. And we definitely want to give them the supports that they need so that they don't fall into depression and anxiety and resort to drugs, alcohol, vaping, these kind of things that will have a negative effect on their physical well-being. But it requires being very creative and allowing them to express their feelings and not feel, particularly for the young men, not feel that it is weak or unmanly to express their feelings if they feel like they want to cry or they feel like they're overwhelmed, to have a forum and a place where they can express their feelings, and those feelings will be validated. And also refer them to these resources. Our website is a very informative website. They may get some information there. There's also the suicide hotline that I wanted to share, which is 1-800-273-8255. Again, that's 1-800-273-8255. Also, the domestic violence hotline, 1-800-799-7233. Again, that's 1-800-799-7233. So yes, not only for the young teenagers, but also for the young children, parents have to be very creative and encourage them to go out and walk, do exercise, maintain social distancing. I guess all of you know that There were rumors going around on social media that African Americans were immune to the virus, which was a very harmful and a very devastating rumor, because we have been hit tremendously by the virus in our community. So allow them to be educated on the virus and offering some alternatives on how to cope within the household setting, and giving people space and giving them voice to express their feelings.
Thank you. That's important because I have an 11 and 12-year-old home, and just trying to keep them occupied throughout the day could be challenging, especially when I have to break out, of course, and work. So, just keeping them on a routine, I think, is important. But I really worry about our preteens and our teenagers, because this is the time when they would like to celebrate with their friends. And, I have a prom dress event every year. This is the first year in 12 years that we haven't been able to do that event, because obviously with what's going on with COVID-19 virus and our stay-at-home orders. So that's just very, it can be depressing for our young people and even our college seniors who are graduating from college now, and they don't have that big fanfare of a college walk across the stage, and now they're just thrown out into the workforce. And unfortunately, the workforce right now is at a standstill. So there's a lot of emotions going on for our preteens, our teenagers, and our young adults, that they really have to have these coping skills in order to move through this in a very safe way. A question that came on, I'm going to read one. It says, can you just call if you're just having problems and you want to speak to someone? Can you just call? You don't have to be necessarily suicidal, but can you call one of those numbers if you just want to speak to someone just to kind of get it out?
Absolutely. Our
Yes.
24/7 crisis line is still the same number. We have one number for access. It's 1-800-241-4949. And there are mental health professionals there waiting for people to call and just to talk.
Okay, great. Another question we have is, where can we send men who have alcohol problems?
I hate to repeat myself, but it is the same number. And what we have, when you call the 800 number, they can ask for those services. They will have a telephonic screening that will determine which is the right referral for that person to go. Or if they know of a place that they want to go to, and people have choice, of course, they can call the number and to that provider, and that provider will absolutely show them where to go for those services that are needed.
Fantastic. And again, the website is DWIHN.org. DWIHN.org, and that stands for Detroit Wayne Integrated Health Network.org. And all of this information can be found on that website.
And I might say there is
Yes.
something for everybody on that website. It's a very useful tool.
Okay, fan. Now I have Galaxy Tab A. Francesca, if you can maybe unmute that person and they can ask a question, go ahead.
Can you hear me?
Yes.
Okay. I had a quick question. If you're in a situation and you're a family member and you have a loved one and you want to advise them to contact this number, what would be the best roundabout way or the best conversation to have with that person who you feel would benefit from these services? How do you address that family member who may benefit from these services at this time from a professional standpoint?
I would say that I think that's a very good question, because I think all of us know people who may need help and are reluctant to get that help. And I think one of the best things that you can do is to talk to them and let them know that there's no shame, there's no weakness, there's resources out there for everyone. And it may be a stepwise kind of process to make an initial phone call and maybe an initial follow-up. But the main thing is to let them know that they're not alone, that all of us are feeling some level of anxiety and depression and worry. And it's important that they don't feel isolated and that they can't discuss it with anyone. And sometimes they can discuss certain things more with a stranger than with a family member.
Absolutely.
No,
Oh, go ahead. Go
I
ahead.
also
Mr.
would like
Brooks, and
to.
then go ahead. Mhm.
I also would like to add to the point that there are two other items that many people are going through that is very difficult. We're having an economic pandemic also. Many people have lost their jobs. The government has issued some payments, but that is only temporary. The government cannot sustain individuals for a long period of time. Many people were living from paycheck to paycheck prior to this pandemic. So it is a major economic disaster on individuals, and it's important that people reach out for the assistance that is available. As Dr. Collins mentioned, you should not be ashamed to get assistance. You should not be ashamed to get financial assistance. This pandemic has a huge financial toll. We're estimating that it's going to require us an additional $50 million just to work through this pandemic and work through our providers, in addition to the money that we already provide throughout the community. So we want people to not be ashamed to reach out and get help. We know that many people are impacted by this, and this is one of the times in which asking for help is a good thing, and it's something that we have to get over.
Absolutely.
Okay.
You know, we have so many people, you know, we have several wonderful food banks here, Gleaners. They're all over the place giving out food. We have the services that you all provide. And I gotta say all that to say, don't be too proud to go for help if you need help. The stigma of mental health, don't let that deter you from seeking the help that you need. If you need food, go get that food. Big unemployment. This is a time that we've never seen before, and there are services available now, and we don't know how much longer those services are actually going to be available. As like I said, the government can't sustain us forever, and the food banks, of course, if this goes on too much longer, they may run out of donations of food. So if you need those services, if you need to call to talk to someone, if you need to go to one of the various food banks, if you need to apply for unemployment, do all of that now, because that will help you in your sanity, knowing that for at least a short term, you have something to sustain yourselves as we move through this crisis. And it will move through. We will get through this. But as of right now, you have to take care of yourself, your family, and do the things that get you through at this moment. Dr. Collins, you were going to say something?
No, go ahead. What you said was exactly right.
Yes, and also, you know, a question came about with the hotline number. Is there a way to text your information or text information to the hotline as opposed to calling in case someone doesn't want their phone number traced? Could you have a texting service?
We do not actually have a texting service at this time, but you can send an email, and our email address can be provided to you so that you can contact us that way, and we will have people get back to you. And it's through our customer service department, which is our main number at 1-313-833-2500.
And I might add to that, if a person has a cell phone or a landline, they can do *67, which blocks their number if they have some concern about being identified.
Fantastic. We have Amy has her hand up. If you could unmute Amy Francesca and have her ask her question.
Amy has been unmuted.
Okay, Amy?
Everyone hear me?
Yes.
Okay. Oh, thank you for taking my question. My concern is that our immigrant community, people that are waiting on citizenship or they're here waiting for asylum and such, that they have very limited resources right now, and they're actually afraid to reach out and use some of those financial resources that you guys talked about because of the current political environment, and worrying that that will hurt their chances of citizenship down the road, or somehow negatively impact them. It seems to be there's a lot of fear in that right now, and I was wondering if there's any specific helpline for them or resource for them, or do we have any information that if they were to go try and get food benefits, for example, at this point, is that going to be held against them when they finally do get their case looked at?
And if I could answer that, if that's a huge fear for people that we serve, is that they're going to lose out or they're going to be punished if they reach out for services. And again, if you call our number, we have providers that are out there that are able to help, and they do that in looking at regardless of the person's ability to pay, they can provide those services. So if you can call that number and it's confidential, you don't have to give any information that you do not want to give, but they can help direct you to the services that will be helpful in ensuring that you can get connected to resources without fear of being punished for doing so.
Thank you very much.
And I
Yeah,
might
that's-
add to
Go ahead.
what Dana just said, that we also have multilingual providers who can speak various languages if necessary. And again, it's maintained confidentially.
Thank you.
That's a great question, because so many times our immigrant family and friends, they're fearful that this may cause them to be deported or whatever the case may be. But we want to reassure and assure them that if you are in need of services, you can definitely reach out to Detroit Wayne Integrated Health for those services, for the various food banks that are here, because we're all people right now just trying to get through this pandemic. So your status is not of importance right now. And even let me take it slightly off for a moment. When we talk about our status, the census is among us. So no matter what your immigration status is right now, everyone has to be counted for our census. So everyone who can hear me, please make sure, if you haven't done so yet, fill out your census forms, because that's how we get the funds for the Detroit Wayne Integrated Health System, for all the services that we provide. We have to be counted, and the government has to know where we are to give us those dollars to help with these programs and services. So please, everyone, fill out your census form. Since you're home, take that census, go online, fill out the form so that we can get all of the money that we need to provide all the necessary services for our residents.
And Commissioner Bell, I would like to add to that for the immigrants, that we fought very hard for them not having to identify their citizenship. And I think that's very important, because we need to have that information, and they do not have to divulge whether they're a citizen or not.
Absolutely, it's very, very important. That was almost a question on the census, but thank God we fought for that to not be a question. We just want to know how many people live where and how many people we have in our county and our city, so that we can get every dollar that we need to provide services for our residents. Absolutely. There's a question that I saw. Let me see. Dr. Collins, the question comes in from Jen. Any tips on being physically connected while social distancing? And while you're speaking, if I can have Francesca bring up the slide that shows the different ways we can help do things to keep ourselves busy. But the question, Dr. Collins, being physical while social distancing.
By physical, meaning within a family unit?
I'm going to say yes, unless they can go to the chat and specify a little bit more. Maybe within a family unit, and just physically, physical exercise as well, I would say.
Oh, physical exercise, definitely physical exercise is very important. If it's done outside of your home, you have to maintain social distance. However, within your home, if no one shows symptoms and you are very diligent in washing your hands, cleaning your surfaces, then there's no prohibition from touching someone within the family unit. Now, if they're coming and going, you have to be very careful of when they come in and when they leave. You don't want them to brush up against surfaces, so the washing hands, cleaning surfaces, disinfecting is a very important aspect of maintaining your health in terms of the virus.
And Jen made her question a little bit more clear. She said, just be remaining socially connected. How can you stay socially connected? She says, some of us are not leaving out of our home, but we have friends and other events we want to socially connect to. How can we do that? And I have a couple of suggestions after you, Dr. Collins.
Well, the screen that I see put up right now is very educational, because it relies on being very creative. Fortunately, we're in a day and age where we have multiple sources of communication, whether it's Skyping, Zooming, telephone, writing letters, old-fashioned writing letters, snail mail. The U.S. Post Office is working every single day. So there's a variety of ways that we can stay connected, and things that we can do to not feel so isolated in your home. Phone calls. I have found that I have talked to many people that I haven't talked to in a long time just because of the social distancing, touching base, seeing how they're doing, what's going on in their community. So it's a matter of being as creative as you can in terms of reaching out and communicating with others.
Very good advice. We have about 9 minutes left, and I want to keep this screen up. But if you could talk about something that a lot of my peers speak on, and that's insomnia and sleeplessness. That is an issue that plagues many of us for a variety of reasons. But can you just speak to that and what we can do to kind of offset that so that we are getting the rest that we need?
I think that is a common symptom that you see during a situation like ours. It's noted in anxiety disorders, it's noted in depression, and it's something that you need to really be disciplined about in terms of exercising, going to bed at a regular time. People tend to binge watch series. Don't do that all into the wee hours of the night. Set a time that you get up, set a time that you go to bed, turn off the lights, create an atmosphere that is inviting to sleeping. Although it is a very common problem, I would suggest too that you may contact your primary care doc and talk about alternatives to assisting you sleeping, whether it's some medication. But before you get to that, I think trying to develop a very regular, dependable schedule and being disciplined about it and exercising every day, decreasing alcohol and drug abuse, eliminating that. These all will help in terms of sleep.
Thank you. Yeah, and those are some of the notes that I captured when I was researching for today. Limiting your alcohol, limiting caffeine, exercising, and then making sure that you black out your room where you sleep, and that you at least have an hour or two of no screen time before bed, because that, of course, interrupts your sleeping as well. Have a couple more questions as we go through this. Any volunteer opportunities? A lot of times we want to do something to help. So are there any volunteer opportunities that the network has?
Right at this time, I think it's very hard for even some of the larger entities like the federal government and the healthcare areas to allow volunteers to come in and to work. We are looking at that if we become more involved in some other things that don't put our people and the folks who are working with at risk. There may be some volunteer opportunities over the telephone. But again, we have mental health professionals that may be available to do some volunteer work to assist in that manner if they can help with giving out information. I think that is something that we haven't explored so much because we've actually transitioned from doing a lot of the work that we do telephonically or through telehealth. But as volunteer opportunities become available, we do have an area that works with volunteers, and it's through our workforce development area. So if you want to send us an email, we can get you more information as those opportunities become available.
Thank you.
I'd also like to mention that there's two things that everyone can do. One, if they can simply try to stay healthy. As people stay healthy and follow the guidelines, it releases the flood on our healthcare and mental health system. So doing your part by staying healthy, washing your hands, social distance is critical. The second thing that everyone can do is to be encouraging. There's so much bad news until sometimes we take things out of proportion. As bad as things are, yet there's many things that we can celebrate. Celebrate the time that you're spending with your family. Celebrate life itself. Celebrate the health and individuals working together. Celebrate knowing that we will get through this. So staying positive, sending that positive message, and staying healthy are two vital components that everyone can do.
Absolutely, because taking your vitamins, which I haven't done today yet, but taking your vitamins every day is so very important to keep up your immune system. Exercising, which I haven't done today yet either, is also very important to make sure that we're just keeping up with our general physical health, and that will certainly translate to our mental health. I have one more last question from Mr. Andre Johnson. It's in relation to SUD and recovery challenges, that's substance abuse and recovery challenges. There are huge challenges in the SUD recovery community. Telehealth is a good option, but many of our clients lack digital devices. Telehealth approval is a current challenge as well. And some of their agency have a 60% reduction in services. Is there anything being done to assist providers with maintaining their sites? For instance, any discussion on that, on how we can help our recovery community and the agencies that provide such a great work in the recovery realm?
Yes, there's a couple things that we're doing. One, we're trying to push out as much revenue to our providers as possible. We made a commitment with our board not to build any reserves, any Medicaid reserves during this period. So we want to make sure that those dollars are pushed out to the community, especially with those providers who cannot provide all of the service. And then two, as it relates to this telehealth is not going away. It hit us suddenly. Many of our providers were not prepared to fully gauge in. However, I want to encourage providers to continue to prepare. This will not be the end. We are going through a completely new culture change. That culture change will involve more telehealth. It will involve more PPE, personal protection equipment, as far as wearing masks and wearing gloves. Those are some things that we will not get rid of. If you look at what's going on in other parts of the country, like Asia, masks and gloves are a normal part of their life. Now, it might not be a completely normal part, but it will be something that we're going to do. So embracing telehealth and embracing personal protection equipment will be something in the future. So even if you're not ready now, continue to prepare yourself because it is not going away.
Absolutely. I think we are entering a new norm for us as we go about our daily lives. It'll be different than it was before. But again, we can get through this. We are strong, resilient people, and all of the great tips that you all have talked about today are things that help us get through it. This slide here, as it states about getting dressed, being creative, unplugging, staying connected, which is so important. Calling your grandparents every day, calling your loved ones. This is a good time to check up on folks you haven't spoken to in a while. Just staying connected is going to be so important for our mental health, and just reaching out if you do need help. As I stated before, if you feel yourself on the edge and if you just need a little bit of someone to talk to, the numbers are provided. And actually on the next slide, Francesca, if you go to the numbers again, these are the phone numbers that we have to help you with anything that you need. That's the 24-hour hotline for the Detroit Wayne Integrated Health Network. And then there's the statewide number. If you're outside of Wayne County, you can call the statewide number. But this is just all the information and resources to help us as we continue to move through this crisis. We hope it's over soon, but we don't know. But while we are waiting, we have to keep our physical and our mental selves together, because this is going to be something that the information that we have is something that we continue to use and to need even after this crisis is over. At this time, I'd like to ask our panelists, because we're at 5 o'clock now, and I didn't want to go for more than an hour, if you could give some closing remarks. Mr. Brooks, if you could start us off with closing remarks.
Sure. I just want to thank you for putting this together. Allowing this communication. Education is so key. It removes the lies of fear. It gives people hope. It strengthens individuals. It instills hope and some type of peace within the community. So I just want to thank you for putting this together and allowing us to connect to the community.
Thank you again for all that you do, Mr. Brooks. We really appreciate you and your leadership. And I know this is a very stressful time for you and your organization. So just thank you for all that you do. Stay strong, and anything that we can do at the Wayne County Commission, we are certainly here to help you. Dr. Collins, any last words from you?
Yes, one thing that I think is very important, and Mr. Brooks kind of touched on it, and that is being grateful for the things that we do have, appreciate the things that we have in our family, the families who have recovered, but also maintain a sense of humor. I think that is so very important. I used to always tease my husband because he would go to Costco and we were stocked with 6 months of toilet paper, which I thought was absolutely unnecessary. But now he looks at me and says, see?
He was wise beyond his days.
He was wise. So if you have any constituents, Commissioner Bell, who need toilet paper, you've got 6 months supply.
I will keep that information right handy. Thank you for that. Thank you, Dr. Collins, for joining us. Dana, any last remarks?
Absolutely. Thank you again, Commissioner Bell. This is wonderful information. And I want to follow up on the things that people talked about in terms of encouraging people to utilize our 800 number, 241-4949. And then the QPR, remember, question, persuade, and refer. If you think somebody is struggling, it's okay to ask them how they're doing, and then encourage them and to call the number for help. And then also refer people to our information. If you know somebody who needs our assistance, please give us a call, have them call us. We're available 24/7. The other thing I wanted to say too in closing is that don't forget about our seniors. A lot of us have not been able to visit with our older loved ones, but one of the things that we've been able to do in our family is just doing a drive-by, so to speak, and just at least waving through the car window and they're waving from their house window. That makes a world of difference just to put eyes on people. So if that's something that you can do, if you're able to do that, just remember, and when you talk about volunteering, if you don't have a older person in your life that you can do that for or with, volunteer and do it for somebody else's parent who may be out of state that you are in contact with, that you can say, hey, do you need me to check on your mom or your dad or your family member that's older and can't get out? So thank you again for this opportunity, because what we do and what you're doing is so important to our community.
Thank you, Dana. I sincerely appreciate you taking time out of your day to do this as well. And I'll say this for full transparency and the fact that, Detroit is a small world. Doc Collins is my sorority sister, coincidentally, and Dana and I graduated high school together. Purely all coincidentally.
About 5 years ago, right?
All coincidentally. So we just have dynamic people in Delta Sigma Theta and at Cass Tech High School. I'll put those 2 plugs in. So thank you, ladies. Thank you, Mr. Brooke. I appreciate you. We could go on and on, I think, for a very long time, but we're going to end it here at 1 hour because I know you have other things that you'd like to do throughout your day. So, but thank you again, and hopefully we'll be able to do something like this again, because there are so many more topics that we can dive into a little bit more. But for now, I just want to thank Detroit Wayne Integrated Health Network for joining us and providing this great information. Please, everyone, stay healthy, stay safe, and stay indoors. It will truly save our lives. Thank you again so much, and everyone have a wonderful rest of your day.
You too. Thank you so much.
Thank you.
Thank you. Thank you so much.